Aloha and welcome to our lecture today. We are going to talk about a very important topic, and that is delegation. Now, I know that the majority of you are already working in healthcare, have had experience working in healthcare, and you probably have heard this word. You may be someone in your workplace that does delegate, or you may be someone in your workplace that gets delegated to. In other words, people like nurses and doctors delegate tasks to you. As a licensed practical nurse, you will be doing some delegation in your workplace. And we're going to talk today specifically about the nurse's role in delegation. And we're going to separate out RNs and LPNs and certified nursing assistants from each other. And a lot of times when we talk about certified nursing assistants, we also might use the term unlicensed assistive personnel. So those might be used interchangeably during our talk. So UAP, or unlicensed assistive personnel, are other people besides, a CNA that help out. So in a hospital, it might be someone like a transporter. It might be someone like a sitter. Sometimes there's a one-to-one sitter ordered for a patient, and that individual might be in the hospital. So there are other unlicensed assistive personnel around as well. And so I just kind of wanted to bring that to your attention before we get started. So delegation. So can nurses get it all done on their own? And we know that the answer to this is no, that there are many things to be done, many tasks and skills. There's charting, there's assessing the patients, there's giving the medications, helping provide comfort for your patient. There's just so many things that we do during a shift that we oftentimes will need to delegate off some of those tasks to others. And the important thing is that we know how to correctly delegate. And there are actually proper rules about delegation, all right? And so sometimes we can get very frustrated when we have so much to do and not enough time to do it. And that can actually cause our patients' care to suffer. It can cause us as nurses to be frustrated with our patients. And so we need to make sure that we are keeping track of how we're feeling, about how much stress we're experiencing in the workplace. Really, that's kind of part of the talk about delegation because, yes, we use delegation in order to offload some of our responsibility in terms of, tasks that we would assign to someone else. But the truth of the matter is that the responsibility is still ours. It still belongs to us, even though we delegate it. And we're going to talk more about that in a little bit here. So, delegation is the transfer of responsibility for the performance of a task from one individual to another while retaining accountability for the outcome. So that's the really important part of the definition. So an example here is that the RN, in delegating a task to an assistive individual, transfers the responsibility for the performance of the task, but retains professional accountability for the overall care. So what do we mean by that? So what that means is if you, the LPN, delegate the task of taking some vital signs, say you say, go to Mr. Jones' room and check his vital signs for me and report those back to me. And a couple hours goes by and you go to lunch and you come back and all of a sudden you bump back into that CNA and you say, oh, yeah, that's right. I told you to check Mr. Jones's vital signs a while ago. Did you do that? And they're like, oh, yeah, you know, I did, but yeah, I kind of forgot to come back and tell you that, you know, his blood pressure was like 170 over 90. And you're like, what? Okay, so it's been about 2 hours now. Your patient has had a really high blood pressure and you didn't know. Okay, so what went wrong? What went wrong? A couple things went wrong, and we're going to get into more detail as we go through the lecture, but the first thing is that you did an okay job at the delegation. You told them what room to go to, okay? You told them who to do the task on, but you missed out on a couple things. You didn't tell them to report back to you, and you didn't give them a time frame in which to report back to you, okay? So that is how you would be still held accountable for the fact that that individual had a pretty high blood pressure for a couple hours and no intervention was done upon that. For example, like calling the physician, giving him a PRN blood pressure medication, and so on and so forth. So that's what we mean by retaining accountability. And the American Nurses Association, in conjunction with the National Council of State Boards of Nursing, came together. These are two national nursing bodies who came together and came up with a joint statement on the complex issue of delegation of nursing tasks to unlicensed assistive nursing personnel, which includes certified nurse aides, okay? And what they said was that in the organizational structure of a long-term care facility, an RN delegates a significant amount of the nursing responsibilities to the LPN, okay, while retaining final accountability for each LPN's actions or inactions under the RN's license, okay? And the LPN, acting as the team leader, assumes responsibility for delegation of nursing tasks to the care extenders. So care extenders, unlicensed assistive personnel, certified nurse aides. So the certified nurse aides who are working on the LPN's team under the LPN's license. So at this level, the LPN retains final accountability for the actions or inactions of the certified nurse aide. So the LPN is the direct line supervisor of the nurse aide position, and the RN is the direct line supervisor of the LPN, okay? And this is in the long-term care setting. So to be an effective and safe, accountable leader, the LPN must understand the difference between complex nursing skills, which require a working knowledge of the nursing process, versus a task, which does not require a working knowledge of the nursing process, okay? And so we're going to look at a couple of examples of what we mean by the difference between the two. So let's take a look here. So for a certified nurse aide, it is perfectly fine for an LPN to delegate the following things: ambulation or walking a patient, bathing a patient, transporting a patient, grooming a patient, providing other hygiene for the patient, repositioning the patient, helping the patient with range of motion exercises, providing skin care, and some specimen collection, right? So maybe getting a urine or a stool specimen, depending on the facility's institutional policies, okay? An LPN, on the other hand, administers medications, can administer medications through a PEG tube. We recently talked about what a PEG tube was not too long ago. Hopefully you still remember that. Administering some IV medications via an IV piggyback or secondary IV, changing dressings, irrigating wounds, monitoring an IV flow rate, suctioning a patient, teaching basic hygiene and nutrition to a patient, handling urinary catheters, and just overall using the nursing process. So you can see the tasks that are listed under the certified nurse aide don't really require nursing judgment, okay? But all of the types of skills under the LPN's scope do require a lot of nursing knowledge to make decisions about whether or not to give the medication, okay? Whether or not the patient requires suctioning and the proper way to do that skill. How to access a Foley catheter while maintaining asepsis, right? So these are all more skills that the LPN needs to use nursing knowledge for to make decisions, okay? So the following conditions must be met before delegating a task to a nurse aide. The task must be within the nurse aide range of function, and we just said what some of those were. The task must frequently occur in the daily care of the residents. Yeah, grooming, bathing, ambulating, assisting with feeding. Little or no modification of the task is needed from resident to resident, okay? So it's just very standard stuff. There's a predictable outcome after the task is performed, okay? And the task doesn't require an ongoing assessment, interpretation, or decision-making skills. And the task does not endanger the resident's life or well-being, okay? So these are the 5 rights of delegation which this joint task force of the ANA and the NCSBN came up with. They said that it must be the right task, okay, meaning it's a task that can be legally and ethically delegated. It must be the right circumstance, meaning that the circumstances are right to delegate the task. Maybe in certain circumstances, you would not delegate a certified nurse aide to check a blood pressure, okay? The right person, and this is the right person to delegate the task to. The right directions or communication. And what this means is, were you specific in telling the nurse aide, you know, Mr. So-and-so has been a little more weak on his right leg since he fell last week. So when you're getting him up, make sure you're extra careful and extra gentle in watching him for signs of pain, okay? And so as you go to get him up and ambulate, it's okay to get him up and ambulate. However, you know, he did have an injury to his leg, and you have to let me know if he has increased pain when you go to get him up. That would be an example of, you know, adjusting the way you're giving the direction to delegate the skill, okay? And then the right supervision or evaluation. And what this means is you're making sure that you have followed up. So in other words, like the earlier example I gave, you're saying, go check Mr. Jones's blood pressure. I need you to do that now, and then I need you to report that back to me within the next 15 minutes, okay? Because then what you're doing there is you're giving the right kind of direction on timing and supervision and evaluation, in that you're getting that information back so that then you can act on that information. Okay, so we need to identify the training experience and competence of the personnel as well, okay? And so what this means is there's a difference between delegating something to a brand new CNA who just started working on your unit last week, as compared to a CNA that you've been working with for about 4 years on the unit, right? The CNA that you've been working with for 4 years, you know pretty well what their knowledge base is in terms of caring for the residents. The one that just started a week ago, you don't know, right? Maybe she's fresh out of school. Maybe she's been a CNA for years and is very skilled. But either way, until you communicate and establish that relationship, you have to make sure you're delegating appropriate things to the level of the individual's education. Okay? Same thing goes for nursing. If you have a brand new nurse on the floor, you're going to make sure that that nurse understands whatever it is you're delegating before you do that, because that nurse is new and you don't know what they know. Okay? We don't make assumptions about what we think people know. Okay? So again, this is just a nice little circle here that kind of shows us the delegation process kind of in another way. It's still the same 5 basic rights of delegation that we just talked about. Okay? So we want to give clear directions and expectations, including a time element. All right? So we want to make things a priority. If it's now, I need you to do it now. A pertinent observational cue. For example, if you go to get Mr. So-and-so up, let me know if he has some pain, and I will come assess that pain, okay? The expectations, right? So what is your expectation for the skill? That they will come back and report it to you in a certain time frame, and so on. So a lot of times when they're new, we would like to ask them to repeat the instructions back to us. We want to clarify that they understand the task, and we want to make sure we're providing appropriate supervision. You'd be like, well, Mary, my gosh, by the time I do all that, I could just do it myself, right? I know that's what you're thinking, but that's not what I'm talking about here. When I say provide appropriate supervision, what I mean is when they're new and you're not really sure yet, do it with them the first time. Have them explain to you what they're going to do before they do it, and then let them go do it and report back to you. What I'm saying is once you've established that they are super solid in what it is that you're asking them to do, then you're okay to just delegate. But until that time comes, you have to make sure that there's some oversight. And I'm telling you, overall, it makes for better, safer patient care. Because you've established good relationships with people, you know what they know, and you're also encouraging them to come to you if they're unsure about something. And that's really important too. So when we evaluate the delegation effectiveness, we want to provide specific and timely feedback to the personnel as well. So for example, if you go with them and say, I'm going to observe you help Mr. Smith get up utilizing the gait belt. So you go with this new person for the first time, you watch them put the gait belt on, you kind of stand by, assist, and watch them get Mr. Smith up from the bed into the wheelchair. You see that they are perfectly capable of doing a safe transfer, and now you know that you can safely delegate that task, okay? So, what delegation is not? Assigning someone a task to do something that you don't want to do, not okay. So, what I mean by that is, here's an example. Mr. K is an obese male and requires more than one staff for his bath and transfers. So we're not just going to delegate that to one individual when we know that it requires the assistance of 2, okay? And so here's the thing. We can't get it all done ourselves. We do need to delegate things. But the example I want to give here is this. If Mr. K needs his bath and there is not another CNA that can help the CNA that you're delegating to, right? Then I suggest you assist, okay? As the nurse, if you help your CNAs out, they will have an enormous amount of respect for you. Now, that doesn't mean that you're always there to help them with everything. However, when the circumstance leads to that necessity and you're there for them, they will be so good to you. I've seen it over and over again. Good relationships between nurses and CNAs make for great patient care, and it makes for a really just a positive work environment, okay? So pitch in when and if you can, because they notice and they will appreciate it. So let's read through some scenarios and discuss whether or not it would be okay to delegate. During Mr. Smith's bath today, observe his skin for any redness at the pressure points that are on his body and report those back to me after you're finished giving his bath, right? So you know that bath time happens on your unit in the early evening before dinner, so around 4 o'clock in the afternoon. And you would like to have that CNA report back if there's any redness on Mr. Smith's bony prominences before dinner. Delegate? Is that okay to delegate? Yes or no? What do you think? The answer is that it is. It is okay to delegate that. That is something that CNAs learn. They learn about redness developing over bony prominences on elderly patients, which can be the beginning of a bed sore, pressure ulcer. And so that is an appropriate thing to delegate. For her to report back to you whether or not any redness was observed. How about this one? During Mr. Smith's bath today, observe his skin integrity in the area of his coccyx and report back the staging of what you see there. If there's some redness, some skin breakdown, I'd like to know if it's stage 1 or stage 2. Is that okay to delegate? No, it's not, because it actually requires nursing judgment, all right? So the CNA can observe for redness, but the CNA cannot determine the staging of that pressure sore. Once the CNA comes back to you and says, yes, there is redness over the coccyx, then you must go and you must assess and you must stage the pressure sore, okay? Routine weekly blood pressure readings for Mr. G. Routine weekly blood pressure readings. Report that back to me after the morning vital signs, which get taken around 7 a.m. So I would expect a report back around 8. Well, it's routine. It happens on a regular basis in the clinical setting. It is within the scope of practice of a certified nursing assistant. They do know how to check blood pressures. And Mr. G has a pretty stable blood pressure. So yes, the answer to this is yes. It is perfectly okay to delegate this task to a nursing assistant. A follow-up blood pressure reading on Mr. Apo, whose reading at 6 a.m. this morning was 210 over 118. He was given some blood pressure medication as ordered, and I just wanted to know if his blood pressure came back down. His average blood pressure reading is around 160 over 100, which is still high, but certainly this morning it was considerably higher. What do you think? Is it okay to delegate this? So this would be a follow-up blood pressure on a patient whose blood pressure was dangerously high, who you gave medication to. So here's the thing. If it was me, if I was that nurse, I would probably want to go check that blood pressure myself and make sure that that blood pressure had stabilized. You know, if you have a CNA who has a lot of experience and you've been in this circumstance with them before, and you know they can go recheck that and report back to you, that is one thing, okay? But when you've got a circumstance like this where you do have an unusually high blood pressure that you have intervened upon and made clinical judgment for by giving blood pressure medication, in my experience and in my humble opinion, I think the nurse has a responsibility to go back and check that blood pressure, him or herself. Document it and then move past that. Hopefully the blood pressure is back to within a safe range for this individual, and we can show that the intervention of giving the blood pressure medication was, you know, it was successful, right? Its evaluation showed that the blood pressure came down to, oh, I don't know, 120 over 80, okay? So again, circumstance, right? Blood pressure reading prior to giving a medication. Is it okay to delegate that? In the right circumstance, it certainly is. The CNAs can go out onto the floor, they can do all the morning vital signs, and they can report back to you. You can use those vital signs to then go and do your med pass. Now, if they come back and there are some abnormal vital signs and you're not so sure, you can always recheck those before you give the medication to the patient. But is it okay to delegate that off in the morning routine? Absolutely okay. And we need them to be able to assess vital signs for us and report back to us to help us get ready to give our med pass, okay? How about feeding a resident, Mrs. S, with a history of dysphagia by the nurse aide Jenna, permanently assigned to this resident? Well, the patient has dysphagia, meaning that she has difficulty swallowing. So that means that only a CNA can feed this individual who you know is good at feeding patients who have swallowing difficulties. In this case, it is perfectly fine to go ahead and delegate to Jenna. Jenna knows a Mrs. S and is very comfortable in feeding this patient with dysphagia. So this is perfectly okay, all right? Would it be okay to assign a brand new nurse aide that you've never seen on the floor before feed Mrs. S? Probably not a good idea. Probably not. You probably might want to delegate that and then be with that nurse aide for about the first 10 minutes of the feeding to see how it's going. Give her some pointers or some cues or some feedback on her technique for feeding a patient with dysphagia, and know that she's doing it safely. And then you're starting to implement those 5 rights of delegation, right? You're giving feedback, you're observing, you're evaluating, right? Asking nurse aide to complete admission paperwork on our new resident. For example, to sit with Mrs. J's daughter and complete the belongings list. Does this require any nursing knowledge? Does it require any complex decision making? Nope. All it is filling out the belongings list, and it is perfectly okay to delegate. It's something that we do routinely on admission, right? Ooh, how about this one? Follow up with a family member upset about his father's lost dentures. I don't know about you, but I've seen this guy plenty of times. This guy is the kind of uptight family member. And he likes to get upset with the staff, and he likes to blame the staff when things go wrong. And you know that, and you know that he can be an unpleasant gentleman to deal with. And there's Grandpa down there with his teeth. He thinks it's all quite hilarious. However, I would suggest that if you have upset family members, that you, as the nurse, with all your poise and your confidence, approach that individual and speak to them about the lost dentures. Do not delegate that to someone who is not quite ready to handle that level of quote-unquote interaction or potential confrontation, right? And even you yourself, the LPN, you may be in a situation where it's kind of getting a little too tense and you kind of need to reach out to your next upline supervisor to help intervene when there's an issue with a patient and a family, okay? Delegation. Midstream clean catch urine for culture and sensitivity. That's a lot of words. Midstream clean catch for urine CNS. Well, this is actually something that can be delegated to unlicensed assistive personnel, as long as you know that they know how to properly get this specimen. So you might say to them, do you know how to get a midstream clean catch urine? Can you explain that skill to me? Well, they explain to you, yes, I go in, I do good hand hygiene, I get the specimen cup, I have the patient sitting on the commode, I go ahead and I clean the patient with the little Cassil soap, a little wipe packet that's in the urine specimen package. Then I have them urinate a little bit, stop that stream of urine, put the cup under, get a clean catch, pull the cup out, take the lid, place it carefully back on the lid, on the container, label it, and send that to the lab, right? So really doing a midstream clean catch really does require knowledge base. You have to know how to clean the meatus. You have to know that the individual has to let a little bit of urine out and then stop it if they can, and then try to get a clean catch in there. And you have to know that you need to set the lid down face up so that you don't contaminate the lid, right? So you know, something that we think is just so simple, yeah, go ahead and delegate it. Well, it's not that simple, right? We've got to make sure that they understand how to do it. But if they do and they've done it many times, then it's certainly fine to delegate this task. This is a task of obtaining a urine sample, okay? How about obtaining a urine specimen from a Foley catheter? Well, probably not, okay? So this is the nurse having specialized knowledge in how to access a Foley catheter or an indwelling catheter to get a urine specimen for a sample to send to lab. So this would probably not be an okay thing to delegate, okay? Mr. L is on Lanoxin for his heart. LPN Janet tells brand new nurse aide Karen to check Mr. L's apical pulse and report back, okay? So the LPN wants the nurse aide to check the apical pulse because we have to check an apical pulse before we can give Lanoxin. I want you to look carefully at the picture here. I want you to think about what's happening in the photograph. I'm going to give you a minute. Do you see anything amiss? Well, if you look carefully enough, you will see that nurse aide Karen isn't checking an apical pulse. She's checking a radial pulse. What do we do to check an apical pulse? Properly checking an apical pulse is using your stethoscope, putting it on the apex of the heart, and listening for 1 full minute, counting the beats per minute. And in that 1 full minute, you come up with a number, which is the apical pulse in 1 minute, okay? So what went wrong here? First of all, nurse aides should not be checking apical pulses, okay? Secondly, did you ask her if she knew what an apical pulse was or how to check it? No. So, number 1, we do not delegate things like checking apical pulses to unlicensed assistive personnel because that is a skill that is an LPN scope of practice. Although a CNA might check a radial pulse, and if you tell them to check an apical pulse, they're probably going to check a radial pulse because that is within their scope of practice, okay? So if this happened, what would you do? And how could you have prevented this? Well, first of all, I think that, it would be okay if you made this mistake, because it would be, considered a mistake. You shouldn't delegate that. But if you did, and then you walked in and you saw the nurse aide checking the radial pulse, it would be okay to say to her, you know what, I just made an observation, maybe not in front of the patient, that you checked a radial pulse instead of an apical pulse. And I understand that you probably don't know the difference, right? And that's okay, because I probably shouldn't have delegated that to you. I really need to check the apical pulse with my stethoscope before I give the Lanoxin, okay? So take responsibility, all right? So we want to gently correct people if they're doing something wrong, right? And on the other hand, we want to maintain our professional accountability for things, and so we need to be owning up to that as well. So the nurse aide cannot decide whether or not to give the Lanoxin based on the apical pulse. Even if the nurse aide knew how to take an apical pulse, it's still not appropriate, okay? The nurse aide can't decide whether or not the pulse needs to be checked again, either prior to giving or after giving the Lanoxin. So see, this all requires clinical judgment. You can't delegate it, all right? You can't delegate it because it requires nursing process. So if we look in our Nurse Practice Acts, it kind of gives us an idea, and these are state practice acts that tell us what the scope of practice is between these 3 different types of nurses. So these are just some examples listed in this table for you to review. You can clearly see that delegation is something that has some gray areas in it. But I think if we stick to the 5 rights of delegation, and when you're answering board questions, if you kind of go through the 5 rights of delegation in your mind as you're answering the board question, I think you'll always be able to accurately answer the question as long as you're using the 5 rights as your guide. Because think about it, we could probably come up with hundreds of different scenarios for delegation. And so how do you decide? You use the 5 rights and you do the best that you can, okay? So I appreciate your attention, and I hope you've learned something about delegation today. Until next time, aloha.